Well, hello. A different kind of video today. I want to go over because it's more complicated these days to actually find a really good dentist. The question is how do you find a real good dentist? Knowing the fact that in today's world, everything is going to the corporate model, big corporate hospitals, big corporate RV parks, everything is being consolidated immensely. I live in North Carolina, and that's happening so quickly here. And it's because you can walk into an office not knowing that it's a corporately run office, and maybe that's just not your style, versus a private office where it'd be maybe more your style. So here's a few little things to consider to find a really good dental practice or doctor that fits your needs. Because you hear the complaints all the time, right? Going into these big hospitals, they rush you, they don't listen to you, they run you out the door, you get a bill. They're just more driven by the bottom line on the profit and loss statement versus actually taking care of you as the patient or customer, right? The client. So more than ever, it's so important to make a determination based upon your values, right? Your values should drive everything pretty much in life, but also your decision of who to see or choose as your dental provider. And so there's 8 things I want to go over, total of 8. And this is value number 1 is what do you value most? Do you value going to a dental practice and having just the cheapest dentistry done? Or do you want to go to a practice that is more value based? And what I mean by that is the cheapest dentistry is you're going to probably get the cheapest price, but the service is going to be not top notch. It's going to be rushed. You're going to have worse materials going into your mouth because they're cheaper. You're going to just kind of be just in and out like a little mill versus you go to some place that actually values providing great service and hospitality where you're going to actually have more time with the doctor, where they actually listen to you and they're using better quality products. And I don't mean it's the most high tech stuff around. I'm talking about the filling materials, the the crowns, the things that are actually in your mouth are going to live there, right? Not the coolest little computer that can scan your teeth. That's kind of irrelevant to tell you the truth. So, cheap dentistry or more value-based dentistry. Number 2, do you want to have just a relationship with your provider or you want to actually have a partnership? And what I mean by that is a relationship is nothing more than just, hey, it's a one-way street. I know you're Jane Doe, and this is it. Fillings, crowns, out the door. Partnership is this. Tell me what you're experiencing. What's your motivation? Where are you going? What are you looking to achieve? What are your goals? All right, what's important to you? And then based upon that context, you actually then form a partnership to provide the necessary solutions and answers to your questions to help you achieve that goal. And everybody's so different. That makes sense? Hope it does. Number three. Number 3 is you want to be able to have somebody to you want to be listened to or you can be talked down to. There's so many different personalities of doctors who will use the 2 ears and listen versus the one person or doctor who will use their mouth to talk the whole time and not hear what's going on in your current state or condition. Number 4 is in the medical world, you can have a model that has one size fits all, or you can actually have a personalized model where it's personalized directly for you, right? Go more corporate. Hey, here's the model. We have fillings, root canals, crowns, and the only thing you do are implants, nothing else. That's how you get fixed. Or you actually have a hybrid, a mix of things that can actually still work, but you put a recipe together that fits your needs, right? More personalized care. Number 5, what services are being offered? Yeah, maybe corporate probably has more money. They probably have more fancy stuff, but all in all, the same service is going to be offered, and it's going to be rushed. It's going to be nice and slow and deliberate with high skill. Not one on one. Not everything's the same in dentistry. Not all doctors are the same, right? If you think about the number of dentists, right, you're going to have half the people are above average, half the people are below average. So, what services are being offered and who's actually providing those services? Oftentimes, doctors who are more in the corporate world are really ran ragged, and they're there to maybe pay off loans, what have you. Number six is how much time you actually get to spend with a doctor. Is it real quick, real rush? Do you get to know them? Or do they take the time to, like, again, listen to you and understand what's going on and not trying to just be rude and get you out the door because they're trying to make more money and see more patients because that's the way things are? Because in the corporate world, you can actually have more insurance based services, which insurances don't pay a lot. And so they're going as fast as they can just to make sure they can actually pay the bills versus private may not be all insurance or Medicaid, what have you. And so you don't have to run as fast to pay the bills. It's more quality, right? Value based versus cheap. Now, at least if it's point number seven is, do you only want to go to a dentist based upon the fact that they are in network with your insurance versus they accept your insurance? When you're in network, that means you have a contract with the insurance company in which they drive down the reimbursement rates to the doctor. And especially if you're a private doctor, they put them way down lower versus you're a corporate because the corporations have more leverage for negotiation. So accepting insurance, if you have a PPO plan, many doctors accept that, many dentist offices accept that. And all in all, the actual insurance companies will pay more dollar on dollar than not being in network or actually being in network. So just because the doctor says or your insurance says, hey, they're not in network, that does not mean they can not take your insurance. So you really want to understand what your values are. That way you can not be insurance dependent and have the insurance dictate who you should see. And lastly is how they're managed. Corporations are managed directly for profit. Right? They could be part of pension funds. They could be corporations for profit. But their main job is to get every little bit of money out of there to show a profit to give back to investors. Where, yes, I mean, if you're a private company, you still got to have profit because otherwise you're not going to be around. However, you're more focused on actually servicing the patients with good hospitality. That way you're able to provide the good service and allow that to take care of the bills and paying employees and the profit. So that is how you want to find a dentist these days, because you can walk into a dental practice and not know it's corporate or not. But with these 8 different things to look for, you should be able to pinpoint and understand and see the different things. Oh, wow, maybe this is exactly what he was talking about. So determine your values, review these 8 things, and make sure you find a dental provider or a dentist that makes sense for you. Just don't follow the advice of insurance companies blindly and have them misguide you what you actually, well, really the care you deserve, to tell you the truth. Hope that makes sense. We'll see you next video.